So this would be indicated, so testing hip internal and external rotation range of motion, if we found in our screening exam that the range of motion were limited or painful. So to get a more specific measurement, we're going to use goniometry. So you're gonna abduct the one leg. So we're just gonna kind of place that off to the side just so it doesn't get in the way. So when we're checking hip internal and external rotation range, you want to, you're going to check the pelvis actually to see when the pelvis starts to move. So if we bring her into internal rotation range, do we see how her hip starts to kind of hike up like that? So see right there, her pelvis starts to hike. So that's what we want to monitor in sitting. So if I put my hand on the pelvis and bring her into internal rotation range, right there is really her end range where her pelvis stays level. And then I'm going to provide my stabilization on the distal femur and go into a little bit of overpressure. Again, I'm always looking up at the pelvis just to make sure that she's not compensating or hiking up. So this is about her end range. I apply overpressure to feel what her end feel feels like. It feels firm. And so then I get an estimate to see about what is this angle. I say she's almost at 45 degrees. So we take our goniometer, get it to 45. Our landmarks are the anterior patella, perpendicular with the floor, and then perpendicular with the tibia so that it's in line with the midline between the medial and the lateral malleolus. So that's your landmark, is in between the medial and lateral malleolus. So we come back up. So try to relax here. So it should be passive. There we go. Okay, so there's her end range. Now, what I typically like to do for this one is I actually usually like to come into kneeling and support the lower leg with my knee, so then I don't have to worry. I have both hands free to do my measurement. And then from there, again, perpendicular to the floor, in line with the medial and lateral malleolus, and on the anterior knee. And she's at about 41 degrees. Okay, and then similarly, you can test external rotation range. So same thing, I'm gonna just be looking at her pelvis first. Okay, that looks pretty good. She's able to stay level in her pelvis. I apply overpressure to get a sense for her end feel. Again, it's typically firm. I'm gonna rest my leg here so that she's supported and can stay relaxed. And then I'm gonna line up my goniometer. Stable arm down, fulcrum on the anterior knee, and in line, midline between the medial and lateral malleolus. Okay. And she's at about 40 degrees. Okay, so that's hip internal and external rotation range. And then let's do knee flexion extension as well while we're here. So go ahead and lay on your back.